Hello, my name is Jason Salami. I'm an associate professor of epidemiology at the University of South Florida College of Public Health. And today I briefly want to talk about all-cause excess deaths. There was a recent paper published in the American Journal of Public Health that's been garnering some national media attention. And I want to try and clarify as many things about this study and about the interpretation of all-cause excess deaths as I can. First, let's do a brief understanding. I believe it was Dr. Lauren Rosen from the CDC who said that measures of excess deaths have been used to estimate the impact of public health pandemics or disasters, particularly when there are questions about under-ascertainment of death directly attributable to a given event or cause. And so for me, all-cause excess deaths help us to understand the higher than expected mortality different locales in the United States may have experienced, either directly due to the health effects of contracting the virus or indirectly due to other ramifications of the pandemic. And so the number and percent of deaths we observe that is above what we would have expected is exactly what excess deaths are. So again, we've got to understand this notion of how many deaths do we observe? I think that's pretty easy for most people to understand. But how do we establish how many deaths we should expect in a particular time frame? And this notion of all cause, I mentioned that at the beginning, it means that it doesn't matter why you died. It takes misclassification of deaths out of the equation, and we're just talking about the sheer entire number of people who died for any reason. And so let's just take a simple example. We often don't estimate all-cause excess deaths for an entire year because there is a cyclical nature of deaths. There's more people who are likely to die during winter months, for example, and so most people estimate the expected deaths either on a weekly or monthly basis. And so let's just assume that we're trying to come up with how many deaths in 2020 for our particular region should we have expected for the first week of 2020. And so what we often do is we look back over a number of years. It might be 5 years. In this case, I've given you an example of 10 years. And we say, well, how many deaths due to any reason did we observe in the previous 10 years? And you can see, obviously, it's not the exact same number from year to year. There is an ebb and flow. But I'm going to simplify it. It's not done in this way. We use a more sophisticated model. However, let's just say a good estimate is what's the average, right? So over the past 10 years, what's the average number of people who have died due to any reason in the first week of January? And so in this case, that's 1,539 in our locale. And so the big question is now to understand whether or not there were any excess deaths. How many deaths did we observe in 2020? Was it more or less than 1,539? And so I'm going to show you a few different scenarios. This is not the full assortment of scenarios that might have happened, but here's some possibilities for what may have happened during COVID in the first week of January, again, just hypothetically speaking. So scenario one would suggest that in this case, we did not have 1,539. In fact, we had 1,847 deaths due to any reason. And in this case, what I've shaded in the red is deaths that are specifically due to COVID. Ones where somebody has contracted the virus and COVID ended up being an underlying or contributing cause of death. So in this case, there's a 20% excess mortality. Again, comparing the 1,847 that we observed to the 1,539 that we would have expected in the absence of the pandemic. And so again, in this scenario, all excess deaths were directly due to COVID. But that's not always the most common scenario. Scenario two now, it's the same number of total deaths, 1,847. It's still 20% excess deaths due to any reason. But in this case, if we focused on the excess deaths, only 51% of them was due to COVID, and 49% was due to a higher rate of deaths for other reasons, right, than we would have expected. So it could have been substance overdose, more heart attacks, for whatever reason, it's reasons that are not COVID. That was 150 of the excess deaths, and then the other 158 was directly due to COVID. Scenario number three, we ended up with 1,768 total deaths due to any reason. That's a 15% excess. And in this case, again, 69% would be due to COVID. And so what I've tried to do here, again, this is just, very crude images, but maybe we observed less baseline mortality than we would have expected, but we've got some new causes of death, the green, that happened in higher rates than we would have expected. And then, of course, the COVID deaths we certainly wouldn't have expected in 2020 in the absence of the pandemic. They are, by definition, deaths that we would not have otherwise observed. And last but not least, this is another scenario. In this case, there's 1,639 total deaths. That's still above the 1,539 than we would have expected. In fact, it's 6.5% higher. And in this case, though, I want you to pay attention that we had fewer motor vehicle accidents, let's say, a reduced likelihood of death for other reasons. And so that's why that blue bar is less than expected. But we obviously had 308 COVID-19 deaths. And in this scenario, the total number of COVID deaths, 308, is higher than the total number of all-cause excess deaths. So again, right now, just put that in the back of your mind. It will come back. So here was the study that was published in the American Journal of Public Health. And what they tried to do was actually pretty simple. It was first to estimate the expected monthly death. We just talked about that, right? How many expected deaths should we have observed in March to September of 2020 in the absence of the pandemic, right? So again, this is just nothing more than how many deaths for any reason should we have expected. Then they wanted to compare that, like we just did, to how many deaths we actually observed for each of those months. And the difference between these two numbers, what we observed versus what we expected, is going to be called the excess all-cause mortality. I have zero problem with this, pretty straightforward, right? And so let's just see quickly how they did that. So in order to estimate the expected monthly deaths for their analytic time frame, which was March to September of 2020, here's just a quote from their article. And, suffice it to say that they used a model that was appropriate, this seasonal auto-regressive integrated moving average. It might sound like a mouthful, and it is, but it's just a model that tries to account for the fact that, again, during a calendar year, there is a seasonal and cyclical nature of deaths. There's not just the same that happens in each week or each month. And this is just a good model to make those projections. And again, notice that they used the 2010 to 2019. So what has happened in the past 10 years will help us to understand how many deaths we should expect in 2020 if the pandemic had not occurred. And in the main table in their paper, this is basically where they plot those numbers. So you can see in March, they would have expected 19,204 deaths for any reason in Florida. In April, it's 18,402, and so on. So step 2, what did we observe? This is pretty straightforward as well. They say we used total all-cause recorded deaths from January to September from the state of Florida Department of Health, which had the most updated data. And again, these are not COVID-19 specific deaths. These are deaths due to any reason. And again, I have zero problem with that. And what that basically places in their table is the top row that you see there. So now we've got what we observed, what we expected, and as you can imagine, the next step is let's take the difference and call this excess mortality. And that's what you see down here, right? They simply subtracted these two numbers and they said, well, these are, again, for any reason that a person died, these are the number of excess deaths we observed in Florida by month. And here's the percent excess deaths that we observed. And so the next step that they take, and this is where I start to have some problems, and we'll go through each of these, but the authors then compare official reported COVID-19 deaths from Florida to these excess deaths. So you can see now they're starting to add some more to this table. Here are the official reported deaths due to COVID-19 for each month as they were reported by Florida. And so what they're going to do is they're now going to compare these numbers to the total all-cause excess deaths, and they're going to come up with the difference. And that's what you see down here. And this is a number, this bottom right number of 4,924, that is a number that has been garnering a lot of attention, and we'll walk through why. So again, there's the excess deaths, right, above and beyond what we would have expected. Here's what they call the official reported COVID-19 deaths from Florida, and here's the difference between the two. So problem number 1 with this study is the interpretation of what we're seeing. So what do I mean by that? Again, here's that table. What they are going to suggest is that in July, so we're going to focus on July, here are the numbers that they observed, and here's what they conclude. These are quotes from the article. In July 2020, the recorded deaths, that's up here, that's the observed, exceeded predicted counts, or what we would expect, by 6,315 excess deaths, of which 3,338 were attributed to COVID-19. My problem is with the bottom statement. They say that the difference between these two numbers implies an undercount of 2,977 for publicly reported COVID-19 related deaths in July. They are suggesting that Florida undercounted COVID-19 deaths by almost 3,000 in this 1 month alone. If you needed more evidence of this interpretation, here's August. And again, they walk through August in their paper. In August 2020, it's the same interpretation. They talk about the total observed deaths, the number that we would have expected. They then suggest that there were 6,500 all-cause excess deaths. They then compare that to the Florida reported number and conclude, in other words, 2,147 deaths were undercounted compared with publicly reported COVID-19 data. So again, this interpretation that the difference between these two numbers, the 6,491 and the 4,344, is somehow underreported COVID-19 deaths. So again, why is implying that the difference between these two numbers, all-cause excess deaths and COVID-specific deaths, being an undercount, why is that a problem? So first, I'm going to acknowledge that a portion of the difference could actually be an undercount, maybe even a significant proportion. Why? Because people could have died, especially early on in the pandemic, they could have died from COVID-19, but have never tested positive. Remember, testing was not widespread, and testing may have not been done post-mortem on some of these individuals. So it very well could have been, again, especially when testing was not as widespread, that somebody could have died of COVID-19, and we did not count them as a COVID-19 case. That is possible anywhere in the United States and certainly happened everywhere in the United States, not just Florida. Here's the big but. What they would have had to have assumed the situation was, in order to make this interpretation of the data, is we expected a certain number of deaths, right? And they would have had to have assumed that any excess deaths that we observed, they were all directly due to COVID-19. These are people who contracted the virus and who would have subsequently died with COVID as the underlying or contributing cause of death. In order to imply that any difference between the excess deaths and COVID-19 reported deaths is an undercount, this is the scenario you would have had to have assumed. But these two scenarios are equally, perhaps even more plausible. The total toll of the pandemic was more than people who contracted the virus and died from it. People lost their jobs, had worse mental health, delayed health care. This ultimately led to an increased likelihood of death from other causes. And these are indirectly, as opposed to directly, related to the virus and the pandemic. Why? Well, people may not have gone to the ER for chest pain. They might have been concerned. I've heard so many things about this. They might have been concerned of contracting the virus, so they would have avoided going to the ER. They might have assumed that hospitals were busy taking care of patients with COVID-19, and let me make sure that they're able to do that, so I'm not going to go in. It's just a little bit of chest pain. They might have delayed their health care for diabetes-related complications. They might have delayed getting unusual abdominal pain evaluated, and it could have been a tumor that was aggressively spreading, right? So there's a lot of reasons in addition to the increased substance abuse overdose deaths that we experience. So these are the other reasons, right? This is why you can't assume that if these go up and cause our excess deaths, you cannot assume that all excess deaths should have been COVID-19 specific deaths. These other reasons, these other causes of death would have certainly played a role in excess deaths. So it is wrong to assume that all excess deaths are due to people dying directly from COVID. Or what about this? Let's say in 2020, so look over at the right here, we have 1,650 all-cause deaths during this week. That's 111 higher than our expected number of 1,539. So there are 111 excess deaths. We only had 60 COVID-specific deaths. So the authors of this paper might have concluded that the other 51 deaths were undercounted COVID deaths. But look over here in 2016, which we used to establish our estimated deaths. They had 1,590. There is an ebb and flow in deaths, and 2020 just could have been like 2016 with 1,590 deaths that would have occurred even in the absence of the pandemic. So if that were the case, then the other 51, the difference between these two numbers, they would not be undercounted COVID deaths, but just part of the annual variability in deaths occurring during a given week, month, year, whatever time frame you're assessing. So again, these numbers, the difference between excess deaths and COVID-specific deaths, it just demands more context and a full explanations of the reasons that could be driving those differences. To me, it's all about providing the appropriate context to the numbers and discussing the full range of possibilities. So imagine this one. This is scenario number 4 that I gave you earlier, right? Where there were 100 excess deaths, 1,639 observed versus 1,539 expected. So 100 excess deaths, but 308 COVID-specific deaths. When COVID deaths were lower than excess deaths, it was suggested that they were an undercount. But would we call this an overcount of COVID deaths? No. We would say, well, there may be fewer deaths from other causes, like motor vehicle accidents, because we're not driving as much. And that's really what explains this situation, at least in part. We would provide more context. Well, why don't we do that for a situation in which COVID deaths are less than excess deaths? And so problem number 2, so problem 1 was the interpretation. Problem number 2 is, in my opinion, the numbers in this paper, they are just wrong. Not all of the numbers, but one of the critical numbers that goes into the interpretation of the data, and I've highlighted those numbers in a box. I mentioned to you that they pulled official reported COVID-19 deaths. This is from the paper itself. We use monthly officially reported COVID-19 death data from January to September 2020 provided by the Johns Hopkins University's Coronavirus Resource Center, which compiles data provided by the state of Florida. You get the picture, right? Sounds very good, and this is a reputable source, but the big problem in this case is these are deaths by the date, in this case the month that they were reported, not when they occurred. Why is this a problem? This is just a graphic from my dashboard. There is a big lag, and again, this is not specific to Florida, this is everywhere. There can be a big lag in reporting from when deaths occur to when they are actually reported. The author's study time frame ended where that blue bar just came up. But the deaths that actually occurred during the author's time frame were still being reported where this red box is in October, November, even December. That is, they missed a lot of COVID-specific deaths that actually occurred and that they should have considered in their study. Was this a trivial difference? Well, first of all, why should they have been able to get access to the more accurate data, which is deaths based on when they actually occurred? The Florida Department of Health, for a very long time, I've been collecting these data sets on a daily basis since last May. They provided this. This is a link to a data set you can download daily. It's updated daily, and it's a very simple data set, but an important one. Each day, they update these numbers, and they give you the date, the number of deaths that actually occurred on that date that were specific to COVID-19, and then this meaningless object identifier, right? But again, the notion that we can get the most accurate data, it's updated daily. And so what difference does this make? What was the impact of relying on deaths based on when they were reported instead of when they occurred? Well, remember the author's table and the statement here about July. They were implying an undercount of 2,977. Well, they reported 3,338 COVID deaths reported by Florida in July. In fact, there were over 5,200 deaths that actually occurred in July that were specific to COVID-19 and reported by Florida. That means the 2,977 suggested as an undercount was actually 1,090, almost a threefold overestimation of what they suggest is an undercount. And so over the course of their entire study, they reported that number that you see everywhere, 4,924 excess deaths attributed to something other than COVID. And again, in a few places in their paper suggest that this number is an undercount of true COVID-19 specific deaths. I believe the true number of the difference between all-cause excess deaths and COVID-19 specific deaths is closer to 2,831 if the deaths by date of death file had actually been used. That's a 74% difference. So this number, 4,924, and sometimes other erroneous numbers like 19,000 or 14,000 from the author's paper have been shared far and wide as further evidence of an undercount of deaths in Florida that are specific to COVID-19. And I just believe this is all wrong. And my last problem number 3, is this should have been a national study or at least been given national context. And part of my problem from the author's paper is this, and I'm just going to read it. Florida was chosen for our analysis because COVID-19 disproportionately affected the state's population, and historically, it has one of the highest numbers of influenza or pneumonia mortalities in the United States. On May 4th, Florida was among the first states to begin lifting COVID-19 related restrictions. Additionally, local governments were prohibited from imposing fines on individuals. There was also increasing controversy regarding the accuracy of the officially reported number of COVID-19 deaths. So maybe with the exception of the highest influenza, I just take exception with this. There are a lot of states that were disproportionately affected. There are a lot of states that lifted restrictions, right? So, targeting Florida is obviously looking for a certain hypothesis that there may have been an undercount. And to not provide a control group, just somebody else, well, let's pick another state and see if we're finding the same difference between excess deaths and COVID-19 deaths, that's just a big mistake. Again, I'm not blaming the authors per se, but at least the discussion needed that context because Florida does not stand out to me when we're looking at excess deaths. Now, this is not from the author's study. The CDC also estimates excess deaths on a weekly basis, provides updated numbers, and these authors of the American Journal of Public Health study, their end findings, like the actual difference between excess deaths and COVID-19 reported deaths, it is not that different from the CDC. So look at where Florida sits in terms of the percent excess deaths since last February. They're middle of the pack. And when you start to do comparisons of the difference between excess deaths for any reason and excess deaths excluding COVID-19, like all of the numbers that we would explore across states and across jurisdictions to try and see if Florida stands out, they just don't. So again, I think this goes towards a narrative that Florida is somehow intentionally hiding or undercounting. And again, with the evidence that I have in front of me, especially with the evidence that was used in this paper, I don't see any evidence of that. This certainly does not convince me because I think the numbers, again, were wrong. And I understand, that a lot of people go very quickly to what's reported by Johns Hopkins, the deaths by date reported. That's very common because not every state reports deaths based on the date that they actually occurred. But Florida does. Those are more accurate numbers, and they should have been used in this estimation. And again, I think it's all about interpretation and context. It was really lacking in this paper. And so I'll end this with the fact that I did submit a formal letter to the editor, to the American Journal of Public Health, just to highlight, have people have at least give the authors of the original paper an opportunity to respond. That has been now in review for 11 days. Usually this is a lot longer than a letter to the editor might sit in review, but everything during COVID-19 has been delayed more than ever. I think editors are have a lot of work on their plates, and so do reviewers of journals. So I'm hoping to hear back from the journal. But that's about it. I just wanted to take an opportunity to express my concerns with this study, especially the fact that it's garnered so much media attention. I don't mind the authors at all approach to estimating excess deaths. That's actually fine. I just think there's a lot of context that was lacking from this, a few numbers that need to be corrected. And so I don't know. I just thought I'd take the opportunity to share my opinion. If people disagree, I'd love to hear about it. Otherwise, I hope that this helps people to understand the study and why I've had such problems with it of late. Thank you for your time, and I'll talk to you next time.